Hey future nurses, let's look at this case study for nursing fundamentals. So we have Mrs. Elena Ruiz, a 64-year-old woman who's one day post-op after an open cholecystectomy. The nurse knows that Mrs. Ruiz is reluctant to take deep breaths due to pain in her incision site and has shallow respirations. Her lung sounds are slightly diminished in the right lower lobe. Her vital signs are listed below. Which nursing intervention is the highest priority to prevent post-op complications? So let's take a look back at her vital signs and see what we have here. So we have a temperature of 100.8, which is slightly elevated, but not super concerning yet. We have a heart rate of 104, which is also slightly elevated. Blood pressure looks normal. Respiratory rate is 22, so we would say that's a little bit elevated. And our pulse ox is 95% on room air, which also could be a little bit lower than what it normally was at baseline. So looking at our complaints of slightly diminished breath sounds, pain at our incision site, and very shallow respirations, we want to find an answer that has to do with respirations. So A says IV fluids. There's really no indication for that for this patient at the moment. That's not going to be our highest priority, so we're going to count that one out. Administering prescribed pain medications and encouraging use of the incentive spirometer. That sounds like a good idea because then she can take deeper breaths and help with her respiration, so we're going to keep that answer. Monitor for laryngospasm. There's really no indication for that in this question as well. We're going to cross that out. And then rechecking the patient's temperature in 2 hours to monitor for infection is a good idea, but that's not really the highest priority at the moment. We want to pick B because we want her to start breathing better to prevent any kind of post-op complications. Hey nursing students, let's review this nursing fundamentals question together. So we have a patient that states, I am not taking that pill. What is the nurse's best response? So let's look at each answer and why we would or wouldn't use it. A is, okay, I will just chart that you refused it. So why would that not be a great answer? Well, you're kind of just dismissing any concerns the patient has, and you're just kind of ending the whole conversation there. So that's not very therapeutic, so we're going to cross that off as one of our answers. B, can you tell me why you do not want this particular medication? So this question is a good way to get the patient talking and also to address some of their concerns. So this is definitely an answer that we can consider. Answer C, the doctor said you have to take it. So this answer pretty much takes away the patient's autonomy and kind of a right to refusal, so that you clearly don't want to say. D, it's just one pill. After this, you can have lunch. Is also very dismissive of the patient. You're not asking why they don't want to take the pill or addressing any concerns. So our answer is going to be B.